Okay, so I have my pelvis here, and I'm going to do a little bit of pelvimetry. So first thing is obviously wash hands, put on gloves and sterile gloves, and ask the patient if it's okay to proceed. This type of pelvimetry exam you would want to do closer to delivery, around 37 weeks, as relaxin and the other hormones that work prostaglandins to soften tissues and all the joints and ligaments. It's gonna be more indicative of what the actual dimensions are. So the first thing is to insert the hands gently into the vagina, and we're gonna push on the coccyx and the sacrococcygeal joint to make sure that it's mobile and that it goes back. And next, we're gonna try and feel the sacrum, make sure that it's nice and concave. Okay, and then we're going to go up to the sacral promontory, which is right here. And this is the diagonal conjugate, so if you can reach this, you know that the AP diameter, the anteroposterior diameter, is going to be at least 12.5 centimeters based on your hand measurements, but typically that will be the case. If you can't feel it, then you know for sure that the woman's pelvis is going to be, the AP diameter will be adequate. From here, we're going to go and try to brush onto the pelvic inlet. So up top, and we'll go back this way. Now this, to me, just feels kind of tricky. My thumb kind of gets in the way and I end up using the back of my hand here. The gentleman in the video said that you would only typically be able to feel less than half of the inlet if it's sufficient, or around, like, you are not supposed to feel so much in one swoop. And then from here, we're going to go down and feel the ischial spines. We want to feel if they are blunt, if they're sharp, if they're parallel and flat. So these both feel nice and flat. And then you're going to go from here and kind of reach and see if you can reach to both spines. I can barely do it, which means that this pelvis is most likely greater than 9.5 centimeters in between the two ischial spines. Okay, and then from here, we're going to assess this diameter, which, I forget what it's called, but it's basically from the ischial tuberosity to the coccyx. And then from here, and then we're going to remove the hand, and on the external exam, we're going to put the fist right here, and it should be, the whole fist should fit, and that's going to give you the subpubic angle. If it fits, then you're going to know it's adequate. So that's a little bit of the pelvimetry. I'm still learning a lot, and I haven't actually started doing exams, so I'm excited to learn more and to keep trying and practicing this art form.